Assalamu alaikum viewers. I am Professor Mizaq Sharif. I retired as Professor of Medicine from Punjab Medical College, Faisalabad. Presently, I am working as Head of the Department of Medicine at University Medical and Dental College, Faisalabad. The purpose to start this video channel is to share the clinical knowledge with the undergraduates as well as postgraduates. Because the many of the clinical examination books, they just do not mention the clinical examination at the moment, and they are loaded with the data of the ultrasound, CT scans, MRIs like that, or the echocardiographs. As an undergraduate and a postgraduate, we need to know how to examine the patient and then pick up the findings and correlate them so that we can come up with one provisional diagnosis. When we start our career as medical students, we are taught about different diseases, and that has got a definite sequence. First of all is the definition, then symptoms, signs, investigations, treatment, and then the rehabilitation for that disease. But when a patient comes to us, patient just mentions his presenting complaint or a symptom. That symptom might be common to many of the diseases, and we have to decide which out of these is the most relevant possible provisional diagnosis. The complaint might not be one, can be more than one. If they are more than one, then we have to arrange them in a chronological order so that the oldest complaint is mentioned first of all and the recent most complaint is mentioned at the end. Our job is to think about the differential diagnosis for those complaints. And the purpose of the history taking is to eliminate the differentials which are not relevant to the patient and to end up with one provisional diagnosis for that patient. All the questions asked from the patient should be in the negative sense. There should not be a leading question in the history. And don't start writing the history immediately when you start taking it, because it should be written at the end after you have rethought about the history which you have taken from the patient. Now, all these complaints about which you ask from the patient, they can be common to many diseases. And the purpose again is to come up with the one provisional diagnosis. The history of the present illness consists of three parts. The first one is the elaboration of the presenting complaints. Second part is the information which you have extracted from the patient and the patients might have omitted it. And the third part of the history of present illness is about the treatment which the patient has taken in the recent past. If the complaint is very clear and patient clearly says that it started this and this much period back and prior to that he was perfectly well, then it's a simple issue. But many a time there are more than one complaints, and patient might be having these complaints in the recent past as well. Then you can either mention these complaints about the recent past in this patient he is having all these problems in the recent past which is ongoing, and now the patient has presented with the complaints of this and this. Or you can mention the presenting complaints and then you can mention that these are also present in the recent past off and on, and the patient has been taking the treatment or taking the advice of the medical professionals in the recent past as well. After this, there is an important thing as well. The patient might give you a history of the diabetes or the hypertension, and in a medical patient, if such is the history, you straight away start your history by mentioning that this is a known case of the diabetes and hypertension for this and this much period, and now the patient has presented with these complaints. And again, the elaboration of the complaints, and after that, you need to ask about the macro and the microvascular complications for the diabetes from that patient. And the simple questions will decide, and like the If you want to ask about the peripheral neuropathy, you ask from the patient that is there any tingling, numbness, or the hyperesthesia or anesthesia of the distal parts of the body. For autonomic neuropathy, you can ask about the delayed digestion. You can ask about the dizziness on standing from lying position. And in severe cases, you can ask about the fecal siling of clothes during sleep, which will tell you about the autonomic neuropathy. For the retinopathy, you can ask about the rapid decline in the vision during the recent past. For ischemic heart disease, you can ask about the chest pain or the sudden severe shortness of breath on exertion. For nephropathy, you can ask about the proteinuria. And for the stroke, you can ask for the neurological deficit in the recent past. After you have taken the history about the macro and the microvascular complications, you need also take the history about the self-monitoring of the glucose, and is the patient aware of the normal glucose levels in diabetic patients, which what should be the fasting and what should be the postprandial glucose, and is the patient aware of the dietary precautions and about the exercise. And then you need to mention all these things in your history of present illness. After you have taken all this history, you need to rethink and then write it. And if you think there is anything which